Okay, thank you everybody. It's good to meet everybody. Shaking everybody's hand. Thank you for attending or watching the video. And as she said, ask questions, we will answer them. We're going to talk about cough and respiratory illness, a very common issue we're having right now. I actually take care of a lot of children in the hospital who are too sick to be at home because they either need oxygen or the secretions are too much or they're having a lot of labored breathing and they need support in the hospital. So I take care of hospitalized children. I also take care of kids that are very sick in the critical care unit or the intensive care unit for kids where they need more advanced things like breathing tubes and so on. So I take care of everybody along the full spectrum. And we're seeing a lot of different kinds of viruses, a lot of RSV still, a lot of COVID, rhinovirus, parainfluenza, a lot of influenza A and B, so hopefully you got your influenza vaccine. But we're seeing a lot of it. And everybody comes in and they have a cough and they're trying to decide, is this a bad cough, is it a good cough, what should we do for the cough, when should we be worried about it, and how do we manage all that mucus that's coming out of their noses and they're coughing about and so on. So I have a few tips that I always do and that I always recommend to families about how to do it. And the first thing is cough is good. Cough is a natural process in our lungs to try to clear out the mucus. And most of the time in small children, especially as they get a little bit older, because they're not blowing their noses very much, most of the reason for the cough is because all that mucus that's being produced up here is going back down and the lungs are capturing them and boom, you have to cough to try to keep it out of the lungs. So, and that's why cough is worse at night. If you ever had your child have some sniffles, they're up in the middle of the night coughing hysterically and you're like, why are you coughing at night? It's because of that postnasal drip. Okay, so there's a few things that we can do to help mitigate some of that at nighttime. But first and foremost, like I said, is cough is a natural process for our bodies to protect itself. The lungs want to protect itself by producing cough to clear out whatever mucus or anything. If you are exposed to a lot of dust, you cough to try to clear it out as well. So cough related to respiratory illness is normal. Let's talk about how to manage it and when it's not normal, okay? So first thing, things that I like to do for cough, especially when there's a lot of mucus involved, is maintain adequate hydration. You have to make sure that the children are drinking lots of fluids because that's going to thin out the mucus a little bit, not only in the nasal passages, but also in the lungs. It'll keep them perked up and give them more energy. So first and foremost is lots of hydration. What do you need to use to hydrate? For kids older than or younger than 6 months, they can be breastfed normally. They may not take as much with each feed. They might feed a little bit less, but more frequently. Because all that mucus, they might have more labored breathing when they feed. So you really want to keep the nose clean, feed them those smaller amounts a little bit more frequently, and they'll be able to tolerate a little bit better. For kids older than 6 months, they can have their formula, they can have some water, Pedialyte, or I like G2 Gatorade because it has a little bit less sugar than regular Gatorade, but it really does well to keep them hydrated. If they're old enough, they can have a little bit of warm broth. The broth or the warm liquids help to thin out the mucus and really allow it to drain out. So those are the first few things that I like to do. Keep hydration, and these are some of the strategies. If you're really having a hard time keeping them hydrated and they're older kids, I have no problem giving them popsicles and things like that, or making popsicles or pops out of the G2 Gatorade or Pedialyte works really well when they're not drinking anything because it really controls the volume that they're taking in. I actually stock a lot of this stuff in my own pantry to pull out when the kids are congested and so on. Second thing to keep hydration up is that if they have a cold associated with a fever, and fever we're going to say is about 100.4 degrees for most kids, and beyond maybe 6 months of age, fever is really any temperature that makes them kind of run down and tired. So if somebody has a temperature of 101 and they're running around the house and they're drinking well, leave them alone. But if the temperature, whatever number that is, makes them run down and tired, or they seem like they're too tired to want to hydrate, and I just said hydration is very important, then we want to treat the fever with acetaminophen or ibuprofen if they're over 6 months. with appropriate dosing to bring down the fever enough that it perks them up and they want to hydrate. The main reason we treat fever is to bring down the temperature so that they'll perk up and they'll maintain good hydration, okay? So those are the first steps. Now, we want to maximize most of our treatments around hydration and around good sleep and being able to function out in the world. I would say if they're fevering, keep them at home until they're fever-free for 24 hours and their symptoms are manageable before you send them back to school and so on. Then you want to get them good sleep, because nobody's sleeping when the kids are up in the middle of the night coughing all night. And we'll talk about clearing out secretions and how to suction the nose and clear out the mucus. Warm liquids is the first thing. So at nighttime, you have to really have kind of a regimen to try to reduce some of the symptoms and clear out the mucus as much as possible to allow them to sleep. If they did have fever, you can give them acetaminophen or ibuprofen, depending on their age and dosing, before they go to sleep. But you really want to do things to clear out the mucus as much as possible. So drinking warm liquids is nice, and then taking nice warm showers or warm baths are nice as well. There's a lot of different products out there that you could put in the bathtub, aromas and so on. I think all those are generally fine as long as they don't have allergies to any of the components of it. I tend to use a lot of, if you want to have a product, I don't endorse anything per se, but I like the Soothing Vapor soap that Johnson's put out. It comes in a green bottle. It smells really nice, but it encourages you to keep in the tub a little bit longer. And if you notice, when they're in the tub with warm bath, especially under 2, the mucus just drains out of their nose while they're in the tub. And that's because the warmth and the mist can kind of make the mucus a little bit thinner, and it just pours out of their nose. So especially at nighttime, you want to give them a nice warm bath, allow the mucus to come out, and then you want to clear out as much of that mucus as you can. And then for certain ages, you can use things like the menthol rubs on the chest and so on, if you like. The ones that have camphor in it, that's a medicine, can be done, but too much can be toxic in children. So certain ages, you want to ask your pediatrician how much to give. And generally put just a little on the chest so they can smell it. Putting it anywhere else in the body probably doesn't help, but putting it on the chest so they can smell it might be helpful at sleep, so that they can get hopefully a little bit better sleep if they're not sleeping. Now remember, as much as they have mucus that's still being produced and still coming down, when they're sleeping and they're laying back, they're going to get postnasal drip. So if they wake up in the middle of the night coughing, that's a good thing. They're clearing out the mucus. You want to go to attend to them, make sure that their breathing is not labored, so that they're nice and comfortable, okay? So these are things that you can do to help with nighttime, all right? Now, suctioning. You can get all kinds of things to clear out the nose. I like a good bulb suction. This is a hospital grade one. There's a lot of products out there. People use like the Nose Frida. I couldn't probably use the Nose Frida because it might block the mucus with the little filter, but the viruses are going in my mouth, and I couldn't do that. So I like a good bulb. And when I clean out the nose, what I do is I'll take the bulb and I'll get a little towel or paper towel and I'll put it next to me. And when you go into the nose, you want to squeeze the bulb first. You give it a good squeeze. Go inside the nostril, point to the outside. So instead of pointing it towards the middle at the septum, you want to point away from the septum. So you go in just a little bit, point to the outside, and let go. And then I squirt on the little paper towel that's right there, and you can see all the mucus that's coming out. You really only have to clean out just what you can see at the nostril here. A lot of people feel like you have to really, like roto-rooter, take everything you can out, but once you get past the nostril, the nasal passage opens up so big, you'd have to suction in like 35 different directions to clear it all out. Plus, you won't be able to generate enough force to get anything from the back of the throat. There are some mechanical ones, things like that have like their battery generated, or you can plug them in, so they're devices. You can use all that as long as you use it safely. You can cause a little nosebleed because the in part of the septum right in the front here, it's very friable sometimes. It can cause nosebleeds. So you just want to be very careful about which one you use. And I've never used anything more than a good bulb suction, because really you want to just clean the stuff that you can kind of see out here. If the mucus becomes so thick that you can't clear it out, or it's really dry, you can do some nasal saline drops or nasal saline spray. Don't want to use medications, nasal sprays that have medications in them, just saline, and that's only just to loosen up if it's really thick. If it's pouring out, then you don't need to do that. You just need to use your bulb and clear it out as much as you can. In the small kids, you especially want to do that right before a feed. So less than 6 months of age, if they have congestion, clean the nose out first. Before they feed, they'll feed a lot better. So I like a good bulb suction. It's what I've always used. It's been tried and true. Some people don't like it because you can't clean it out, but occasionally I'll just suck up a bunch of soapy water and swirl it around and squirt it out. Do that a few times. It really does clean it out okay. If you don't have nasal saline drops, you can make some. You can take a cup of water, sterile water, so it has to be either boiled water that's cooled to room temperature or sterile saline, and you add to a cup a half a teaspoon of non-iodine salt, so it cannot have iodine in it, like iodinized salt, just regular salt. And then you add 1/4 of a teaspoon of baking soda to that, mix it up, and you can use that as the saline drops. Just make sure it's sterile fluid first. Then lastly, what I'll say is if the reasons to go get checked out is if symptoms are causing labored breathing, so breathing more than 50, 60, 70 times a minute. You can really see the ribs moving when they're breathing. If you hear excessive amounts of wheezing, wheezing doesn't always mean they have asthma. Wheezing means they have mucus in there, but you want to be assessed to see if they have something that can resolve with medications. Not every time you go in to see a provider or a pediatrician because of cough symptoms, you're going to walk away with something in your hand to make it better. The reason to go in and get checked out is because they don't look well enough that you feel comfortable watching them at home, and you want to get reassurance that you have to change course or continue to do what you're doing and have better expectations. Most of the time, these illnesses last 3 or 4 days to the worst of it, and then they start to resolve. And most of the time, you're going to get checked on the 3rd or 4th day. Usually means things are getting a little bit better, probably in the next 24 to 48 hours. If they're ear pulling, if the fever lasts more than 2-3 days, if they're not drinking well and the activity doesn't get up with, perk up with Tylenol, these are also reasons to get them checked out. So hopefully this was helpful information for you all. Again, if you have questions as you watch this, I'm happy to get them at any point in the future and answer any of the questions that you guys might have. And stay healthy and safe during this respiratory season, and hopefully everyone can stay in school and get ready for a nice summer coming up.
Thank you. I have a question.
Yes.
Can you mention nebulizers, and if a physician, if your doctor recommends a nebulizer, if they don't tell you to use one?
So nebulizers that have albuterol, that's for wheezing. So if you have asthma or the muscles inside of the lungs get really tight, you can be assessed on whether you need a nebulizer with a medicine called albuterol to relax the muscles. And usually when you have a wheezing sounds like a really short breathe in, like you breathe in a little bit, and then they're trying to breathe out really hard, and they breathe, I can't, makes me cough doing it. So that's what a wheeze sounds like. And if you have that, you can get the lungs listened to, and albuterol might be helpful. Some people try things like nebulized saline or humidifiers at home. And I would say those are probably fairly unproven methods, and people try them, and you try everything because the kids are miserable and you want to do anything to make them feel better. But as far as like a recommendation, there hasn't been enough information that the American Academy of Pediatrics or any of the governing bodies or children's hospitals out there can make a recommendation about using non-medicated nebulizers. Even humidifiers are kind of hit and miss. If you feel like it helps, go ahead and try it. I don't particularly like humidifiers because they get moldy. And the recommendation is that you clean it all the time. And I don't need more devices to clean. I'm cleaning everything. So unless it has a true benefit, and I would say a nebulizer, if you're prescribed one because your doctor thinks that you need one, in patients that have RSV, they will get a little bit of improvement right after the nebulizer. So you get the nebulizer and you'll see an improvement for the first 5 minutes immediately afterwards. You'll see that on anybody. But the improvement that you see should last at least an hour. So if an hour later after the breathing treatment, there's still improvement, then it might be helpful. If you don't have sustained improvement after an hour, probably didn't help. You probably don't have to waste your time on it. You can focus on clearing secretions, making sure hydration's really good, treating fever, make sure their energy's okay, and observing them to make sure that their breathing looks okay. I get asked a lot about home pulse oximeter devices. Should we watch oxygen levels at home? I think it's really complicated to interpret the values that come out of it because some people might worry about different numbers and what does this mean? I get a lot of text messages from family and friends. What do I do with this information? And I say, please don't ever look at that. This is why we have the ability to evaluate you at your office. If you're that worried that you're looking at oxygen levels that closely, maybe we need to get an evaluation and decide what kind of observation needs to happen. The most important thing is to look at your child and say, you don't look well, and I don't feel comfortable with how you look. I need someone else to tell me that this is okay, or what I can do to make it better, or it's going to get better on its own. And that's the kind of information that you can get. We have great pediatricians at the Valley Hospital and the medical group that can go through all this, make evaluations. If they're sick enough, you come to the emergency room and they can look them over, maybe get an x-ray if they have to. But ultimately, you should never walk out of an office of any doctor without information that empowers you to know what to do, know when to worry, know when to come back, and what the expectation is for how it goes. I would say most of the illnesses right now are causing cough to last for 2 to 3 weeks, and that's okay. But if you're always trying to feel like it should be better by now, we need to have better expectations of what the course of the illness is going to look like, and that's what we can provide. So thank you for listening. That was a really good question.
Thank you so much. Everybody out there, stay healthy, stay safe, enjoy the snow. It's kind of snowing. Have a happy weekend.